probably already know that colostrum is the first step in starting calves off right. But what are the other factors that come into play? Welcome to Beyond Colostrum, the show where we'll talk about how to optimize your calves with science and research that goes beyond just colostrum. We'll challenge the ways you typically manage your calves, and you might learn some new concepts beyond what you're already used to. Thanks for joining us as we go beyond colostrum.
Well, good afternoon, everybody. I'm Mike Chubb, Managing Director of Saskatoon Colostrum, along with Dr. Mike Nagorski and Dr. Travis White. We want to have a chat around what we're calling calving kits. It's the time of the year we need to think about our preparedness when those little creatures come out, sometimes in tough conditions. I know Dr. Mike and both Dr. Travis have a lot of personal direct experience with their own beef herds and practices respectively. So I'd like to start the conversation with Dr. Travis regarding what you recommended back when you were in practice in Dakotas to your producer clients.
Yeah, so we've got to think about what are the essential items that we need when that first calf hits the ground, right? And so in my practice, we put together calving kits that would incorporate all of those items that had been lost or damaged throughout the year. And when that first calf hit the ground, we were adequately prepared to assist with calving and get that calf off to a good start. So the major things that we need to look at is we need to have a clean bucket with some sort of disinfectant. Typically chlorhexidine would be the recommendation to have there. We need chains and handles. In some instances, we may need to have a calf jack available if we need to put a little more pull on those calves. And then beyond that, we need to have 7% iodine to dip the navel. We need to have some lubricant. There's lots of different lubricants on the market. I tend to gravitate more toward water-based lubricants because J-Lube, for example, is an excellent lubricant, but if there's any indication that we may go to C-section or if there's a uterine tear or something like that, that J-Lube can be detrimental to the cow. It can cause some peritonitis and can actually be fatal to the cow. And so, but having some high quality lubricant available as well. OB sleeves and latex gloves so that we can keep ourselves protected and clean during the procedure. And then beyond that, we need tags, tagger, a tag marker. Hopefully we have a weight tape so we can identify what the birth weight of the calves are. And then probably one of the most important but overlooked things is we need to have some colostrum on hand. Colostrum can, in the beef industry, can sometimes be overlooked, but we know from data that's been collected that about 33% of beef calves fail passive transfer. And so oftentimes we get the question, well, why, Mother Nature has this perfect system. Why is 33% of the calves failing passive transfer? Well, you have cows that produce low potency colostrum. You may have cows that have leakage from the udder and dilute the colostrum out. Things like first calf heifers typically don't produce enough volume of colostrum. When we run into issues of dystocia, then we know that the stress of calving can actually decrease that calf's ability to absorb colostrum. When we have twins, there may not be enough colostrum produced maternally to support both of those calves. And so there's a lot of instances where we probably need to think about at bare minimum supplementing those calves with some high quality colostrum until they can get up and nurse mom. And then in other instances like dystocia, twins, orphan calf, then we got to look at doing full replacer doses for those calves. And so then, coupled with that colostrum, we have to have an esophageal feeder so that we can deliver that colostrum in a timely manner. And so we, again, oftentimes get questions on what esophageal feeder should I have? Well, I prefer having something that has a plastic tube that has some flexibility. The stainless steel ones are easier to clean, but they don't have that flexibility and can actually cause some injury to the calf. And so if we're using those plastic tubes, they can get damaged over time and they need to be replaced routinely so that they're not collecting bacteria or harboring disease there. Beyond the things that we've mentioned, work with your veterinarian to have some oxytocin on hand for milk letdown and to help with uterine contractions and things like that. Again, I would encourage you to work with your veterinarian to identify what exactly you need on the farm, but at a bare minimum, we need those things that have already been mentioned: the chains, the handles, bucket, disinfectant, colostrum, and an esophageal feeder as well.
So, every cow, we hope, if she's pregnant, is going to calve. Dr. Mike, and I know you're responsible for a lot of high value calves in the past. What's been your experience in terms of, say, percentage of hard pulls or needing some level of assistance, and what kind of practical advice did you need to have available in the form of a kit?
Yeah, no, where I was previously, we had a lot of IVFs, embryo transfer, even clone calves, and with those technologies, we had about 10,000 recipients on through the system, and then a full-time calving center. And so, we dealt with a lot of dystocias or difficult pulls where we had to go in and help a cow out in that. In the dairy side of things, there's a metric, and I think it's somewhat something we can follow in the beef cow calf side, but an intervention rate of 17% is somewhat the average on the dairy cow side. Now, are we saying with Angus and breed and all that's all going to be the same across all breeds and that? No, but generally speaking, if you're a herd in the cow calf side that consistently is trying to breed to calving ease bulls, you should see minimal intervention rates where you have to go in and pull a calf. But where you get into some heavier birth weight bulls or crossbred cattle, you can get into more variability there in terms of birth weight. And so, it's gonna be very different and more variable on a beef cow calf side. But the biggest thing that we have to probably be doing and spend the time doing is actually monitoring our calving scenarios as we go. Typically, we want, if our rule of thumb is typically once a cow enters stage 2 of calving, and stage 2 of calving is she's actually exposing that fetus, into the environment or the active contractions, and that this is after the water bag breaks. And so, on my farm, as well as in previous experience, once we saw that water bag out and then break, typically we wanted to see that calf and have good progression within 1 to 2 hours or so. People ask a lot, can you go too fast? Yes, you can. If, let's say, you went before the water bag has been expelled and broken, or if the cervix isn't dilated properly, and then you're trying to pull a calf through a small, tiny opening that's not ready yet for that to be, and then that's detrimental to the cow. So, I think the biggest thing is monitoring the calving events as we see it, and that also ties right into what we need. Once that calf is born, whether or not that calf may or may not need colostrum. Does the calf get up and suck mom? Our goal is to have that calf bond with mom first, and that mother and infant bonding happen, and then that calf to get up, suckle mom. So that's on the calf side, it's up to that calf to be vigorous enough to get up and suckle mom within a timely fashion. But then also we have some variables on the cow side. Does she have enough udder fill? We know too that first time heifers, have a tendency not to have enough volume, and so as we monitor both the calving part, we also need to think about having that calf get up and sucking mom and making sure there's enough there. And that's where, again, to Travis's point, having some colostrum on hand is very pivotal. You mentioned, Travis, that, we got upwards of 33% of the calves failing passive transfer in the beef cow calf side of things. I think it's pretty practical and a good practice to probably have, if let's say your herd size is 100, it would be good to have at least 10% of your herd size in terms of replacement or supplemental doses of colostrum on hand. If you're probably not doing 10 to 20% of your calves, you're probably not doing enough based on what we see in terms of research and variability on farm. So I think it's a good thing to be prepared. So much and so often, Dr. Travis and I get calls, and typically it's been 24 or 12 hours after calving and somebody is searching for colostrum. Well, we know through research that, basically after 12 hours, that window of opportunity to do that calf right with supplemental colostrum, and that is kind of gone. And so it's better to be prepared and ready. And that has a lot of relevance for what we're doing with weight gains and performance.
Yeah, it's an emergency kit. It's not we can wait and get to it kit.
Yep.
That's for sure.
Yep.
One of the things that strikes me, your comment on the 33% failure of passive transfer. Now, we've seen those numbers globally, but practically on a cow-calf operation, how many calvings are you going to actually see as the ranch operator? And what are you prepared to go intervene with if they're not up close? I think that's always the challenge, right? When you're making that calculation of, well, if there's 100 head and you're going to have a 10 to 20, how many are you going to actually see? Obviously, your protocol for getting out there and surveying the field or the close-up pen or whatever it is going to drive how effective you can be. But no question, Mike, on your own beef operation, how much intervention are you seeing there? I mean, on your own beef at home in the home farm.
Yeah, we're over the last 3 years, we have averaged about a 33% intervention rate. And that's my own brother is the herdsman. He's at home all the time and doing this. And, for him, I think if I go 4 years back, the biggest thing that we saw as far as economically what we could do, we calve in 3 different groups, and they're AI and embryo transfer calves. The first groups are, usually born in January and February. And so they're born through a calving facility. And part of that is it's cold outside. So you got to be there to make sure the calves are getting up or, thermoregulated and all that kind of thing. But then, the other aspect of it is watching for dystocias and managing the colostrum side. 4 years ago, our last group was born in April. And that group in Minnesota here, we have spring planting that happens. And that year it was particularly an early planting season. And so my brother, who has to both do crop management and also cattle, had to get into the field. And so we took that last group that was born in April. There was a contemporary group, about 25 head is all. They calved out in the cornstalk fields out in the open. And we said, you know what? We're not going to monitor this group. We're going to let Mother Nature do what it does. And we did that. And we've been blood testing our calves for passive transfer on farm. And we averaged a 4% failure rate in our January and February calving groups. And then it was about 22% in the April group. And we said, why did that happen? Well, we let Mother Nature play out, and there were some calves that must not have received colostrum at all for whatever reason, didn't get up and suckle mom in time, or it might have been that the cows didn't give enough. For whatever reason, Mother Nature didn't really work in that sense. And so as we looked at within that calving group, those 22% of calves that failed passive transfer, they were 120 pounds behind their contemporary groups. And when we went to sell them as feeder cattle, okay, they sold 120 pounds lighter and actually 20 cents higher per pound because they were in a lighter weight category. And by the time you added it all up, there was a $300 difference in what we got with those failure calves versus the calves that passed or had successful passive transfer. And so can I afford to spend money on making colostrum right? Yes, I can. That's why we make sure that we prevent failure passive transfer. You know, Travis, I think we've always discussed as veterinarians, you know, bovine respiratory disease complex is $1 billion industry every year. And yet it seems we can't get that number down, you know, and yet we have 33% of beef cow calf or beef calves failing passive transfer. And we know that these calves, you know, had a heightened risk of respiratory disease if they do fail. So it's in our best interest to do that. And that's why we do, you know, as high of intervention as 30% on our farm. And that's why I say 10 to 20% at least. We're at, you know, 33% or so.
So we talked about, you know, statistics and likelihood of failure. I mean, the title of this particular discussion is the emergency kit, the calving emergency kit. And you have practical packaging approach to this, Travis? Is it hidden behind or under the seat of your truck? What's the value of that thing in terms of, you know, all the dollar costs that you just, you know, let's summarize it, ballpark it with the lube and the chains and the bucket and so forth. What's it look like? What's the best carrying mechanism? You know, briefcase, suitcase, toolkit, toolbox? What do you got?
Yeah, so I really like the idea of a toolbox, you know, where you can keep all that stuff in, or even a bucket. You know, again, in my practice, we sold it all in a bucket. It came in, you know, we put everything in the bucket. Clients would come in first part of the year and grab their calving kit, and out the door they would go. The problem with the bucket is you got to take everything out, and then you've got to put disinfectant in there. And so here more recently, I've kind of gone to like a DeWalt toolbox and put everything in that toolbox, and then it's readily available. And you throw that in your pickup, your calving truck, you keep it in the calving barn, wherever you're actively calving, and you've got it right there at your fingertips. And in that toolbox, you can put everything in there that you need. Everything fits nicely. You can kind of pack it all in there, and then it's there ready to go. The other thing that, you know, especially when we're calving out on in the open, if we're not calving through a barn, is getting a nice thermos that we can put some hot water in, so we don't have to run back to the house and bring hot water and things like that. So having some hot water with us so that we can mix that colostrum up right on site and get it delivered to the calf as well.
How many times do you use a tube? Do you dispose them after one use? Do you clean them? What's your actual practice? Because I know a lot of folks are kind of reticent to chuck away a tube after only one use.
Yeah, so with the tubes, they should be cleaned and disinfected between every calf. But you can use them multiple times. Once we start to see some abrasion or scarring on the bulb of the tube or on the tube itself, then it's time to start thinking about discarding that and getting a new tube. You can buy just the replacement tubes, and that'll save some cost that way. You don't have to buy the whole esophageal feeder. But yeah, once we start seeing any scarring or damage to that tube, then it's time to replace that tube out. You know, there are some applications out there that come with a disposable packaging as well. So the colostrum would be in a bag already. You put a disposable tube on it, deliver it to the calf, and then the whole thing is disposable. So that's another option that is out there, is to have something like foundation on hand, where it's packaged, ready to go. You add hot water, feed the calf, and throw the whole system away.
Right. Well, I feel like I have a good visual on what that kit should look like. Is there anything on that list that we can't get at our normal farm store? Or how do you go about? I mean, you're both veterinarians, so you have your own supplies, but, you know, for a producer, can you get it all done at the fleet store, or do you need to talk to the veterinarians?
For the most part, you can get it all at your fleet store. The only thing that would be outside of that window would be anything that's a prescription drug. So things like 7% iodine for dipping the navel, you'd have to get that through your local veterinarian now. We talked a little bit about oxytocin and having that on hand. Again, you'd have to get that through your local veterinarian. But most everything in the calving kit, the equipment that you need is readily available at your local farm store.
Good. Well, Dr. Mike, do you have any closing thoughts on emergency kits and preparedness for calving?
I think that covers most of it. It's it's going to be highly dependent on geographic region, but the cold certainly brings new challenges, and so that I think if you are in a cold region, you're definitely going to want to be amped up to get more prepared, because as we all know, cold just makes things more difficult.
Yeah, and as a guy sitting in the quasi-Arctic of Canada today, I can agree. I really wouldn't want to be calving out there, but it's happening. So certainly the hot water, the extra colostrum, and your own protection is a good idea, so you can stay patient with her while she's calving.
Yep.
Well, good. Dr. Mike, Dr. Travis, gentlemen, appreciate both your counsel, and good luck staying warm. And to the producers out there, if you have any questions, you can find both Dr. Travis and Dr. Mike at sccal.com with their first names with the dot in the middle. Happy to help you think out your preparations for calving. Have a good one.
Thank you.
Thank you.
Thank you for watching today's show. If you have questions about something you heard today, or maybe you have a topic you'd like us to address, leave us a message on Facebook. We'll talk again on Beyond Colostrum.